We're going to call up our last speaker, Dr. Moos, before we go to lunch. He is a trauma healer, a medical doctor. He received his MD from the University of California, Davis, and went on to complete general surgical training at Keck School of Medicine here in LA at USC and at the Los Angeles County Medical Center. He's had the distinct privilege of helping and healing those in need for nearly 2 decades, although he does not look old enough to have done that. He's an expert in leveraging new medicines using precision skill and pragmatic healing frameworks. He guides his patients through a process of self-discovery through blending psychedelic and somatic healing practices. Welcome, Dr. Moos.
Get stuck in a loop on that one. So I have the unfortunate task of following that extremely entertaining and informative talk, as well as being the barrier to lunch. So I'll do my best to go through the slides as fast as possible and cover everything I can. So as you heard, I am a trauma surgeon. I left my career in 2019 and started pursuing other ways of helping people heal. And that included my own journey through psychedelics and my own journey in reframing what was a healing framework. So my start into this realm started with personal injury. My first trauma was at 6 years old. That little dude, sunglasses, or with the eyeglasses, had to deal with separating his family because my parents got divorced. I was a Mexican-American kid in Huntington Beach. I was bullied. I was misattuned. I did not have a lot of place to hold my feelings and my emotions. So injury after injury, I moved through high school. I developed a relationship, an unhealthy relationship with alcohol, hung around the wrong people, eventually was able to find a clear path towards education, nearly dropped out of high school, ended up finally getting things together in college, found a pathway into medicine, and just started amping up all of the maladaptive coping strategies. So alcohol became a substance of choice, infidelity became a behavior of choice. And I worked my way through 2 marriages until my life just finally imploded. And it was in those moments when I found myself in rehab here in Santa Monica, a little over just about 8 years ago. And I did some serious soul searching about who I was and what I was doing in the world. And it gave me an opportunity to reconcile who I was with who I thought I was. And so the sum total of my actions were of somebody who was in the community hurting people, hurting myself, hurting the people I loved. And I had an opportunity to really sort of embody the fact that I thought I was a kind, caring individual. And so with my medical training and a whole host of education, as well as personal experience, again, with psychedelics and with self-healing, I started a company called Soul Surgeon by Moos MD. So there's been a lot of talk about history. And so I'll try and take what everyone has said so far and just tap on certain elements just to keep the flow of the conversation. But when talking about the history of psychedelics, there are theories that date back to 100,000 years ago with the stoned ape theory, which is basically a bunch of Homo erectus individuals or hominids started eating massive amounts of psychedelics. It caused a rapid acceleration of brain development, and that's what led to the development of Homo sapiens. But the more recent history still is thousands of years old. If we look at Maria Sabina, the woman up here, she was a curandero out of the Mazatec region, north of Oaxaca in the Sierra Madre Mountains. She was excommunicated from her community after bringing Gordon Wasson and his wife Valentina in, and they brought the Westerners to Mexico looking for the magic mushroom. There are 3 different examples of what indigenous practices look like. This is in Peru, an ayahuasca ceremony. Up in the top is a ibogaine ceremony, which is from the Witi tribes in Western Gabon. And then in the middle is a peyote ceremony for the Native American indigenous. And these predate probably 1,000 years BCE on record. Brian Murescu, who wrote The Immortality Key, wrote about around 500 years BC, predated Christ, the giving of a sacrament, ergotized wine that was known as kikion. And kikion was a hallucinogenic wine that was given to try and commune with the mystical. And so the sacrament of giving wine ended up being appropriated by Christian religions and was given as a sacrament. They took the ergot out, which ergot is a black fungus on rye, which is where LSD comes from. And there's some controversy and discussion about the origins of religion and mysticism. So this is a picture of the Time magazine in 1950 sign, which R. Gordon Wasson is given most of the credit for bringing Westerners to psilocybin, but it was actually his wife who was a pediatrician, scientist, both of them are anthropologists and mycologists, who went in search of the psilocybin mushroom. So those ones were natural plant medicines, and then we talk about synthesized medicines. And so the three main ones, there's a whole host of them, but the three main ones that we're talking about really are MDMA, ketamine, and LSD. And ketamine was developed in 1912, ketamine was developed in 1956, and LSD from the ergot fungus on rye was developed in the late 30s. But the image of Albert Hofmann on his bicycle is commemorated on April 19th, 1943, where he was working with the substance and basically saw the world melting around him. He got on his bike, tried to get home, barely made it home, but then had these profound realizations. And that was the start of LSD sort of sneaking out of the labs and into the community. But before the 70s, this was part of medicine. Timothy Leary was an individual who was sort of a radical individual, highly controversial, was quoted saying, "It's time for people to turn on, tune in, and drop out." He was responsible for a number of research studies that were maybe unethical, and was a champion of the psychedelic movement, so much so that he would create these polarizing sort of feelings in the research community and the social community. So in the 70s, we're actually in the wake of the 60s, we had what looked like a growing body of evidence of psychedelics in psychiatry, in mental health, in therapy, and these medicines naturally started coming out of the lab and being used in recreational settings. The counterculture movement was a movement that was centered around the war in Vietnam, which was roughly 1958 to 1963. This was an anti-establishment, anti-government, anti-war movement that the government was looking to marginalize and criminalize. And there is no better way to do that, to look at a group consuming a substance and say, that's illegal, now they're criminals. So Richard Nixon passed the Controlled Substance Act in the 1970s. It made all of the psychedelic Schedule I substances, marginalized this movement, and it was perpetuated with Nancy and Ronald Reagan in the 80s with the DARE program. What this really was two things. First, it was a war on people, not on drugs, and it was a war on science. And if you see the decline, this is just of psilocybin, and this is from the Beckley Institute. You can see the radical downgrade of scientific studies because there was basically no research outside of very few indications to be able to be doing research on psychedelic substances. So in the wake of this, there's sort of this new renaissance of what does this all mean, right? A lot of the talk about psychedelics and the use in our current culture started around Michael Pollan's How to Change Your Mind, which is 2018, right? We're talking about 5 years and we're talking about thousands of years of history. But it has sparked conversations, different conversations. So it's not just sort of this trippy experience from the 60s and then this illegal sort of subset on the other side. What we're starting to see is major academic institutions. I think at current date, there's 8 or 9 major academic institutions at Hopkins, Berkeley, Harvard that are doing groundbreaking research. We see groups like MAPS and Compass that are doing rigorous work to get these to be legalized substances so they can move off the Schedule I set and B, or have open access to funding and research. And then we're also seeing this massive increase of startups. Right now, the psychedelic industry is a $4 billion industry, but people are projecting it to be a $100 billion industry in the next few decades. So then why? Why are psychedelics so hot? What is the point of doing all this research? If you look at the current state of the mental health, the impact of the mental health burden, it is unbelievable. So 1 in 5 people in the US are affected with mental health. But if you ask people who are around those who suffer from mental illness, you know that everybody is impacted by it. If you look at the rates of addiction, we talked about the rates at which vets are dying. The average rate over the last 20 years is about 20 vets per day are dying. So that number goes up, that number goes down. And then if you look at the impact on our adolescent care, our young people are suffering. And they're suffering in the wake of the pandemic. They're suffering in the wake of social media, in this digital world with enhanced connectivity, and they don't have a lot of options. And if you look at parents now, if you go into a room and look around a room, I would guarantee you 90 to 95% of people are now looking like this. They don't make eye contact. They don't attune. Kids are now being raised by parents who can't look them in the eye. So it's no wonder why people are suffering. So what is it all about? Trauma. For me, it all boils down to trauma. If you look at the ways in which people develop beliefs, mindsets, perspectives, handle conflicts and tensions, or develop maladaptive coping strategies, it all relates to trauma. This is an art installation at Burning Man, but it really tells a beautiful point. It's these 2 individuals, 2 adults who cannot connect, but deeply inside, there is an inner child wanting to be seen, wanting to be heard, wanting to be valued, and create a sense of connectivity. It's a story of dysregulation, right? Right now, hopefully everybody is in a nice, relaxed, parasympathetic mood. You're able to take in what I'm saying, what other people have said. But when you're stressed, you go into a sympathetic state. You go outside of your window of tolerance. And when you're hyper aroused, you go into fight or flight. When you're hypo aroused, you go into freeze or submit. And those states create patterns of overwhelm, dissociation, and compensatory mechanisms that can lead to a lifetime of impairments. When we think about trauma, we think about dissociation. Dissociation is when the external circumstances overwhelm our internal abilities to cope with what we're being dealt with. And what happens when we do that? That's when people describe these out-of-body experiences. They describe that they're unable to, they're sort of observing themselves. They're no longer engaged. And what happens is, as we're forming an autobiographical timeline in our life, those moments come out of our autobiographical timeline, which is why people with PTSD can have a sudden trigger, a smell, a sight, a sound, and re-experience everything that they've walled off and fragmented off because it has no time. There's no time. This is not happening now. This is not happening 10 years ago. You feel like it's happening right then in that very moment. So how do people, what usually happens, right? Usually pain. Pain is the great motivator. It's the touchstone to change. So what happens is people have trauma. They learn to cope, whether that be through maladaptive coping strategies or positive coping strategies. Those turn into learned behaviors. There's patterns, beliefs, mindsets, and perspectives until something happens. There's usually something happen, and unfortunately for most, it's usually pain. And in that moment, we're faced with a choice. We can either change or we can stay the same. And oftentimes pain is the great leveler where the pain or the energy to change is finally less than the energy to stay the same. So then what are our tools, right? These are the tools that most people get, right? They get talk therapy and they get SSRIs, depressants, anxiolytics, stimulants, something that can provide sort of the promise of an immediate fix. Talk therapy can go on for weeks, months, decades with maybe little, minimal, or no improvement. But the reality is the conventional tools are rapidly failing and they're not adequate to keep up with the meteoric rise in mental health. When we're talking about SSRIs versus psychedelics, we're talking about a serotonin story for the most part. There's some exceptions. But if we talk about SSRIs, we're talking about the 5-HT1A receptor, which really is responsible for enhancing our tolerance to stress, our resilience to stress, and ability to emotionally blunt. If we're talking about the 5-HT2 receptor, which most psychedelics trigger, we're talking about novel solution finding, unlearning and relearning behavior, and emotional processing. It's a very different strategy. If you want to be stuck in your situation and tolerate it, that's what an SSRI is for. And that can be very good for a temporary aid, but ideally you want to be able to resource individuals so they can go back into their lives and change the circumstances so they're more supportive and nurturing to their well-being. And then you have people searching, right? They're searching for alternative tools. The conventional tools aren't working. So they're bending themselves in yoga. They're breathing themselves into a conscious, a psychedelic state. They're looking for sound baths. They're going to goop. They're trying acupuncture. They're trying everything they can because they want answers. So here we have the promise of emerging therapies, right? So we talked about psilocybin, which is that COMPASS study. We talked about MDMA, which is through MAPS. The interesting part about the MAPS study that doesn't get mentioned a lot is 67% no longer met criteria for MDMA, but 93% had a substantial reduction in their PTSD symptoms. That is not benign. That is a massive amount of reduction in symptomatology for people who don't generally respond to conventional therapies. And then there is a whole host of data on ketamine and its use for mental health applications. The nice part about ketamine is I'm part of an adolescent ketamine group. So we're looking at taking some of the models guided by Phil Wolfson and his team and some local people down here. And how do we take some of these ketamine models and apply them to our young people that are suffering, typically the 13 to 17-year-olds. So it's kind of fun because there were some things that were mentioned that I feel like I have the slides to support. So here's the functional MRI studies of the brain that are lighting up, right? So in the top of this LSD one at the bottom, there's a hypoarousal of the brain. You give LSD and you see this hyperconnectivity. The same with the connectivity model up at the top. That's a brain after being administered psilocybin. And you think about some of the positive neuroadaptive coping mechanisms, and you start to realize that in rodent models, we are seeing evidence of neurogenesis. In other models, we're seeing evidence of neuroplasticity, synaptogenesis, reductions in neuroinflammation, essentially an optimal environment for brain growth and development. So if we're talking about giving somebody tools and skills, we're creating an environment, an optimal neural environment to support change. So this is Gold-Dolan, and this is the slide that was being referenced. And the interesting part about Gold-Dolan, and it's unfortunate because he left, the guy who asked about ketamine, what makes ketamine a psychedelic? There are so many things that you could use to describe ketamine as a psychedelic, and nobody probably puts it better than Scott Shannon, who's a physician, psychiatrist out of Wholeness in Denver, wrote a beautiful paper that was just published about the benefits of ketamine as a psychedelic. But when I think about ketamine as a psychedelic, it reopens a critical learning window. It is one of multiple medicines or drugs that were studied here, but all of them have different pathways. So ketamine is an NMDA antagonist, psilocybin, LSD, and ibogaine are classic tryptamines, MDMA is a phenylethylamine. All of them work through different mechanisms, but through Gold-Dolan's work, which was published in June in Nature, if you look up critical learning windows, Gold-Dolan, you'll find the paper, it is open access. You'll see that these windows that are generally open in adolescence or after injury are reopened, which means that the psychedelic experience, so the shorter ones, shorter opening the window, longer ones, longer opening the window, can reopen areas or pathways in the brain to induce learning. Now, you don't want to induce injury, like create a stroke to try and get this neurogenesis, neuroplasticity pathway to be active, because that would be counterintuitive. But she did a number of studies that looked at blocking the SERT pathway, blocking the NMDA pathway, and then blocking the 5-HT2A pathway, and giving all three drugs. And what they found that is when they blocked one, there were still downstream benefits of inducing this critical learning pathway, which means they all share a common downstream mechanism, which is TBD. And the sort of mic drop moment was when she said that psychedelics could be the master key to unlock learning and healing. It's a pretty profound statement. So what do, right? You have options. What do you do when you have something, sort of these conventional tools or something that's promising these physiological and neurobiological changes? And as I said before, there are times when SSRIs, conventional therapy, can be really beneficial. I'm not here to trash conventional therapy. I'm not here to trash SSRIs, because they all serve important tools. But thinking about it in the way of, what are your internal resources and do they meet your external stressors? Because there's two ways to change. You need to rebolster or reinforce your internal resources, or you need to change your external circumstances to be able to match your environment and thrive in it. We've heard the word journey a number of times. So why journey work? I'm sure there's a whole host of reasons why people say journey work. Mine is predicated around Joseph Campbell's A Hero's Journey. So there's 3 phases, and it perfectly encapsulates the psychedelic experience. There's a departure from an ordinary state of consciousness. There is an initiation into a non-ordinary state with the psychedelic medicine. And then there was a return with discoveries and realizations that can be integrated back into life. This is about accessing content, in my opinion. It's not about doing the work. There are a lot of people who come to this work saying, okay, when is ketamine going to fix my problems? Okay, when is this going to fix my problems and give me the answers? These medicines don't create content. They allow you to access it. A big way to differentiate, am I working with an enthusiast or am I working with a healer, is to figure out, are they teaching from a framework? Do they have skills? Do they have experience? Have they done their own work? Right? There are a lot of wounded healers in the world, and this is separate from psychedelics. But have they done their work? Are they able to provide a set of skills, tools, safety, and employ a framework when guiding clients through an experience? So my framework that I've been developing and will eventually at some point make accessible for clients and practitioners alike is predicated around the tagline of creating the conditions for your love and light to shine. The prerequisites to doing any of this work is safety, transparency, and trust. If you do not have those 3 things, you cannot be in a vulnerable state with a medicine, a setting, or a provider. This framework that I hold is a little bit more extensive than the idea of set and setting, because it sort of belittles the fact that if you just have the right setting and you have the right mindset, everything's going to be fine. But there are other elements that go into the medicine other than just the medicine set and setting. Conditions. For me, the conditions that I've sort of grappled with and think are the most impactful are integrity, nurturance, play, stillness, and connection. And those conditions extrapolate out to a whole host of things. So nurturance isn't just about what you're putting into your body, but it's how are you talking about yourself? Are you saying you're an idiot, or are you saying you made a mistake? What are the ways in which you're nourishing your mind? You're using your words, you're using your environments to provide external support. The next element is love. And I think of love as a 3-part focus, or a 3-part essence of connection. Love of self, love of other, love of creation. Your love of self is your work that you're doing with yourself to help heal yourself. Your love of other is the way that you connect to your peers, create community, and have a cohort to be able to navigate life with. And your love of creation is how you relate to the world, the universe, the cosmos, something bigger than you and keeps you connected with purpose and meaning. And then your light. Your light is your purpose and meaning in action. What are your gifts? What is the service you're giving to the world? Because everyone has their own unique gifts that they have to offer. This is the space where I do all of my work. It is a home. It does not have anything that resembles a clinical office. There's no visible blood pressure machines. There's no visible pulse oximeters. There are rescue meds. There are all the things that I would need in the event of an emergency, but you come in a safe environment with warm blankets, soft pillows. We usually have some sort of soundscape on that's parasympathetic inducing. It is calm, it is supportive, and it is a great place to do work. We have a beautiful outdoor heart-shaped labyrinth that people can walk through, and it's just a really remarkable place to do journey work. So when talking about a lot of these medicines, there's a couple elements I think are really important. So one, these are spiritual catalysts. And a catalyst isn't sort of referencing these things as tools. The thing that makes these psychedelics so impactful is to have a catalyst means to rapidly expedite a process that would normally take a set amount of time. So in therapy, you might do 5 years of therapy, you might do 10 years of therapy and eventually get there. You may do 2 or 3 psychedelic experiences, maybe even 1, and get to the same endpoint. It is a massively efficient machine or a massively efficient tool to help you get to a place that you need to get. But it is not bypassing, right? These medicines cannot do the work. After you gather the information, it is up to every individual to do the work. And in looking at this iceberg diagram, that is where most of our mind is above the water. It's the 10% of our conscious mind and maybe the other 10 to 15% that we can recall through memories. But most of what we've been through lies in the unconscious mind. And it's a matter of going down into the depths and pulling it up and being able to wrestle with it and reckon it. Integration. This is how we start to, and I use this analogy a lot, how we help people to find the keys which open the doors for the blocks or the fragments or the walls that they've created in their life through trauma. And I imagine there's something very similar to meridians. And I am not a Chinese medicine practitioner, but I've had acupuncture and I've been told a number of times that the needles can help unblock areas to allow the energy or the chi to flow within you. And so if you're thinking about us as whole beings, how are we unlocking and unblocking these internal obstacles? Another way is perspective, right? When we're in trauma, we have tunnel vision. If you walked around your whole life thinking that this is the only way that I can see, and all of a sudden you have a medicine that widens that out and you have options and you have choice and you have new things that were not originally available, you might be making different decisions as opposed to running automated reactions when you hit certain stimuli. I don't know if anybody has an old PC or is familiar with PCs, but we used to have to defrag our hard drives because what happens over time is you lay on data, sort of like our lives, we lay on memories, and then we have these other things that come on. And through our work, we start to pull out the shame, we start to pull out the narratives, the stories, the unsupportive things. But what these psychedelic substances can do is they can help us recreate a sense of continuity, something that makes sense. So we're not this patchwork of stories and experiences, we're something that makes a coherent story. And then integrity. I love this picture that's behind it. It's an example of something called kintsugi, which is the Japanese art of wabi-sabi. And kintsugi is finding beauty in the imperfections, right? They take these art bowls, plates, whatever, smash them, and then mend them with gold. So the fracture line becomes the beautiful part of restoring the integrity of the vessel. So I have a couple of case studies that I want to share, and I'm going to share them quickly because I know probably everyone's hungry and either get or getting sleepy. So a case study on addiction. I had a 50 some odd woman who came in with longstanding history of alcohol abuse. She came in and ended up doing a single 6-hour session with MDMA and psilocybin. She was in the beginning stages of delirium tremens. So there needed to be support with respect to providing clonidine and Ativan to support her withdrawal. She had a profoundly deep experience that kept her abstinent for 4 months and then has been maintained abstinent after starting on a ketamine program to make sure that she does no longer relapse from her alcohol. She's been an alcoholic for 30 some odd years. Another case study on sexual assault. I had a 28-year-old woman who came in with repeated bouts of sexual assault, domestic violence. She had a 6-hour experience supported with MDMA and psilocybin. She was at the time working as a stripper. She spent 6 hours breaking open, crying. It felt like her entire body was releasing trauma after trauma after trauma. After that single experience, she quit her job. She reconnected with her family. She left a relationship that was highly abusive and is now in an amazing place in her life. Couple in their late 40s, married for 23 years, were struggling with gridlock, lack of communication, outdated gender stereotypes. They did an 8-hour experiential that included MDMA and psilocybin, using the Gottman Institute as a framework for relationship. I was able to help them create clear lines of communication, move through a substantial amount of gridlock, which really started around their assumptions that they didn't want to burden the other with the other's sort of problems, that enhanced their connectivity. They now have reshaped the way they communicate, are planning to come back in another year for another experiential to sort of enhance their connectivity. And they're developing new rules and sort of guidelines with their kids that allow them to focus on themselves as well. This is one of the coolest ones I've worked on. So this started out as a mom and a wife of a family. She is 52 years old. She has a long-standing history of self-abandonment. At 23, her stepdad inappropriately told her that he was in love with her, that he wanted to leave his wife, her mom, for her, and then proceeded to call her every night for the next month. For 30 years, she held on to this secret. In 6 months of working with me, I think she did 5 or 6 different journeys. She was able to taper off of her SSRI, tell her family the secret she was holding, unburden herself, unburden her family, and find a pathway of happiness and wholeness. In healing her, I've then helped 12 members of her family. I've helped an 88-year-old mom. I've helped 3 of her own children. I've helped stepkids, siblings, brother-in-law, brother-in-law's kids. I don't even know where we're going to at this point, but like cousins, like 12 people in the family system. Their family system has fundamentally changed. They now speak to each other openly, honestly. There's no stories, there are no narratives, there's no deceit. So then we start getting into the range of human optimization. So I had another gentleman who came to me in his 50s who was looking to make an exit, CEO trying to make an exit. And you'd think that you're like, well, how the hell are psychedelics? This is sort of like the Silicon Valley vibe. Like, am I going to give him psychedelics and he's going to have this epiphany? But interestingly, all of the answers and the blocks that he was looking for all centered around his trauma. So I love this picture because you have like Succession, which is this totally toxic environment. And then you look at these kids, like we're all just kids, like trying to be adults at some point. And a lot of his trauma was predicated around how he was treated as an adult. He had a father who was an extreme pessimist. He had a mother who had her own history of trauma that passed along fear and certain beliefs. And through our work together, he was able to make the changes within his company and have that successful exit. And the last one I wanted to share was a professional athlete came to me, had a very public fall in a national scale, was blamed, criticized for trying to trip another athlete, which I looked at the tape, is absolutely no indication of that. She went back to Eugene where a lot of these meets were ran, and she had a PTSD response. She started to get extremely nauseated, a twitch in her eye. She couldn't compete. She was facing being dropped from her team. We did a single psilocybin session. She couldn't work with MDMA just because of the drug testing. I didn't want to put her on the banned list. And with the psilocybin experience, she went on in July to win her event at the USATF National Finals. So this is a term I'm trying to coin, and I really like it. It's PPE. It's the new version of PPE. So with PTSD, there is a there's a traumatic event that happens, stress disorder. You have a stressful set of reactions that occur in response to this traumatic disorder. But with psychedelics, the thing that makes them so unique is we don't stay, so CBT is cognitive behavioral therapy. We don't stay in a cognitive lens. We drop through all integration lenses. We go from a cognitive to a somatic to an intuitive or embodied place. And PPE to me is post-psychedelic embodiment. You are able to feel something at a level that you don't have to think about. You're able to bring it into you and integrate it into your being as a way of truly knowing what it feels like. So there's a comedian who talks about this, named Shane Moos. He says, After a psychedelic experience, you can go and see, grandma's pillow, and all of a sudden it makes sense. You're like, home is where the heart is, of course. But you start to realize when you have these experiences in your mind, there's no way to differentiate that they didn't happen in real life. And what you're taking with you is an experience that you're going to integrate into your essence and is going to be supportive and nurturing for everything you do downstream. So this is just, who is this work for? There are a variety of clinical indications. Most of these are going to be DSM-5. And the reason they are is because they're IRBs, they're clinical trials. They're looking for legalization. They have a very narrow scope because they need to minimize the confounders. They can't be switching environmental or cultural context because it creates variables that you have to explain if you don't see response. But the vast majority of these experiences have been held in tribes, in cultures, in a society where they have been incorporated and integrated into the day-to-day life. Most of these psychedelics are actually given as rites of passages in a lot of indigenous tribes. But you can start to see when you're not looking at from a clinical lens that there are a lot of applications for this work, from trauma to creativity to mystical experiences to human optimization, and then everything that is part of the human condition. That's it.
Thank you, Dr.
All right, with time to spare.
Thank you, Dr. Moos. We have a question from online.
Yeah.
From Jenny Garcia. Hi, Jenny. I understand the healing power these provide on an individual level, and I know you spoke about the government's suppression of these medicine in the 70s. I'm wondering about what you think might be the social or even political implications of opening up access to these medicines currently.
So it's interesting. So I'm curious on that question. So when I hear of open access, I naturally go to sort of the cannabis route, which to me, like, fine, cannabis isn't my jam. Like, I don't like cannabis, so I'm just naming my bias. I don't know what it looks like for open access with these medicines because I see a lot of irresponsible recreational use. Now, I think there needs to be more conversations. I think there can be responsible use. I think there definitely is responsible use, even in a recreational setting. But I think it just gets slippery. I also don't think it's the right model to put it only in a medical context. I think you're missing a huge component of these medicines that have really been stewarded by cultures, by societies, by people, indigenous peoples who've been working with these medicines far beyond the IRBs and the p-values and the statistical significance. So I don't know what it looks like for open access. I just think that with so many people in the mix, it's going to get really confusing before it gets clear.
Thank you. Thank you. Thank you for that. Another question from online, Mark Gomez. Do you yourself have any experience, or do you know if there's any research comparing the effectiveness of psychedelics in PTSD versus things like EMDR, brain spotting, somatic experiences, et cetera?
So yeah, there's a lot of other. So I know for PTSD, the most effective non-psychedelic, I think, is EMDR. I think Bessels van der Kolk wrote, The Body Keeps the Score. And I think they were citing up to like 80% effectiveness with EMDR. Brain spotting, all of the neurofeedback, neurolinguistic field, there's so many different ways. And I mean, even looking at, I don't know, a whole host of therapies, I don't know what the efficacy is as far as the traditional models of therapy, the traditional models of medication versus psychedelics. There's no comparison.
Thank you for that. Let me get some questions in the room.
I'm curious about how you inform or educate clients on experiences that are not so easy or positive. Oftentimes, this type of work can either put you into really dark shadow space or dealing with intergenerational trauma, and how clients move into maybe some healing crisis, as like we all know as acupuncturists as well, we can kind of put them into discharge. I'm curious about how you manage that, is that part of the preparatory or integration process, and kind of, how you work with that.
So there's the idea of like the bad trip. I'm going to go two different ways. So there's the idea of the bad trip, and the bad trip to me is a missed opportunity to help somebody recontextualize a very challenging and difficult experience. So one of the ways in which I provide sort of intake and screening is there are a couple things that I check just to see what their resources are. I ask what their practices are. So I get a sense of how they're able to contemplate and deal with stressful situations, what their self-care is, and then I ask what their support is. So their support is, do they have professionals they're working with, peer groups that they're working with, and then take an entire psychedelic history. People that are new to this work, have no practices, have limited support, are not going to get big doses, right? They're going to stay somewhere where they develop a level of comfort. Because my first experience with psychedelic medicine was like learning to walk again. I had no frame of reference. I didn't know what was going to come up. And then eventually I moved to a place where I'm in the jungles of Peru, sipping ayahuasca, having a terrible experience that included a lot of vomiting and a lot of experiencing. And so everyone is going to be different. And there are definitely going to be people, even when you sort of anticipate they're going to hit that space where they're dealing with something challenging. So if you've been with somebody, and this is the sort of the pitch for everyone doing their work, if you have lived a life, you have been through your own shit, and you have worked through it, and you accept and love yourself, then you will have a frame to be able to help people contextualize what they're experiencing. So you're not just sitting there with your hands in the air like, well, I've never seen something like this. I don't know what to do. Which is why when I look at I look at Oregon for all the great work that they're doing, and I see the barrier to entry for people coming in. I mean, the first 3 people, one of them was an alpaca farmer. Like, I don't know anything about the alpaca farmer, but it makes me question, like, is this person going to have the skills and techniques to be able to support somebody through a challenging experience? I don't know. But you look at the barrier to entry, and some people are getting certified in, I don't know, 6 months. And this is like the sum total of their experience in non-ordinary states, and maybe even holding space as a healer. It's a little scary. I don't know. Yeah.
I've done ayahuasca and I've worked a lot in like Costa Rica and Peru.
Yeah.
And in their traditions, the plant becomes the teacher. I'm not familiar how they do it here in the West, but a lot of the shamans there, they encourage that. You ask the plant, you go in there, you ask the plant, you deal with it. I mean, do you guys even encourage that, or is that just like still considered pathological, voices in the head, you see things and you communicate with these things?
No, so
but it seems like it's all the shift of the teaching goes to the practitioner and not the plant. That's what I've been seeing here.
So glad that you asked that question. So I'll preface it with a couple different answers and then hopefully answer your question. So the idea of asking the plant stems from and I've been looking for this study. I read it a long time ago, but it's how do you prime your subconscious? It's sort of along the lines of what's your intention setting. There's a way of, I don't know if anyone has an old lamp where you turn off the lamp and the filament slowly glows down. That to me is what priming the subconscious is. If you have it in your conscious awareness of what you're wanting to explore, it will give directionality to the medicine. So when you're in a psychedelic experience, it can help uncover what you're trying to explore. There is a push in the medical psychedelic community where now everyone has this highly intelligent inner healer, and you just need to give the medicine and the highly intelligent inner healer is going to do the work, which I sort of agree with and I sort of don't. Because if everyone was doing that, they could do it in recreational instances or even self-guided and they'd find all their answers, which is correct. So then there are people who have an agenda, right? They're teaching their form of theory or practices to people, and it is highly suggestive. I think that the benefit is if you have somebody who has a framework that is helping them, the individual, get to their answers, right? So techniques and skills isn't necessarily saying that I'm pushing an agenda, What I'm doing is I'm giving them opportunities through open-ended questions, through silence, through experiences, through somatic practices, so they can figure out the answers with somebody so they're not doing it on their own. So I'm essentially a mirror holding space for them, getting them to redirect the experience back into themselves each time. It's so that they say, well, what did you do, when you, got divorced, and say, I'm curious why you're asking about that. Just try and figure out what is going on for them so I can fold the experience back into them each and every time. So when I hear somebody say, ask the plant, I want to also preface, I do not work with any sort of medicine that I do not have a practice with or have been given permission from any lineage. So I don't work with ayahuasca. I don't work with peyote, and I will not. And I will not work with ibogaine. Those are sacrilegious sacraments in those cultures, and I don't appropriate those cultures. So I can't answer that. I can give you an opinion, but I can't answer that. My opinion is, huh? Yeah, so I don't tell people to ask the medicine. I tell them to ask themselves, because I want to create a level of empowerment on how they're connecting with themselves, as opposed to saying, I need the medicine to give me this answer. Right. And that is something that was reshaped to me. I took my 2-year chip in AA, and then I didn't go back to 12-step. And I did that because I heard a lot of disempowering language around once an addict, always an addict, meeting makers make it. If I didn't get to this meeting, I would have relapsed. Like, that's a very disempowering model. And so if I tell somebody that this has your answer, I don't want to create a relationship. Just like I think of addiction. Addiction is less about substance and behavior, but what's your relationship to that substance or behavior? So I don't want to create a relationship where they think that the power now is in the plant, or even the power is in me, but the power is in the container that we create together, and that they have the ultimate authority.
First of all, thank you for a wonderful lecture and your insights and sharing your own story. I'm 46 years in medicine, and my number one rule is do no harm. That's why I shifted from Western medicine to Oriental medicine. But also I'm a hypnotherapist, and my question is there any work done to combine psychedelics and hypnotherapy, kind of both go into the same place? And is it safe, in your opinion, to combine them? And can that help to reduce the dosage of the psychedelics, but achieve the same kind of reaction or effect for the patient?
Yeah, I want to preface it by saying I'm not a hypnotherapist. I've never undergone hypnotherapy. I've always wanted to, like, be the guy on stage that does wacky shit, but I haven't. So I can't answer from experience, but I can answer from an incredible interest in mixing modalities. So coming up, I'm doing a ketamine and sound bath at the end of the month, trying to figure out ways to mix modalities of healing. Because again, we're talking about psychedelics. I just look at psychedelics as they're a tool, right? Like, what other tools can we create a synergistic response with? And so it would make sense to me that you could, but I know that there are concerns about mixing modalities. Like, I don't know if I would mix breath work in a deep peak psychedelic space. That could be hugely problematic. But maybe, like, before the onset of the medicine, before the anxiety starts to build, before all of that, like, it might be a nice centering, but I would, again, keep it small. So there's ways that I would approach doing that, but again, I don't have any basis to answer it. So I always say, if I'm answering with no experience, or if I'm answering from an informed opinion or anecdotal or evidence-based, and I don't have an informed opinion.
No, that's just to add on to that question. So I've co-facilitated these journeys, and I've used acupuncture to start with, as an example. So then I can flip the switch and get the patient from sympathetic to parasympathetic right away. And I've also, because I'm a certified hypnotherapist, I've also used hypnotherapy in terms of guiding. And I have noticed that actually patients who undergo that require less in terms of dosage to achieve that same outcome, if you will. So I do think, because it's new, we don't really have a lot of data in terms of experience on combining different modalities, but I do feel strongly that obviously there are compatible modalities that can be incorporated during and after. I think the value is really in the after integration process, where we can add a lot of value, because you're not going to be going on journeys all the time. But what you're going to be doing is you're going to be doing the change work. And then that's when you need the most support. And that's where we as practitioners can really be there to, let's say, facilitate meditation, as well as using acupuncture, herbal therapy to deal with, to support them in their journey. And but those are good questions. One question here.
Just one quick, you bring up a really good point. And I worked with a couple actually now more than a couple, probably a few dozen of individuals who have taken normal, moderate, or even heavy doses of psychedelics and have not shifted the needle. And there is a concept in internal family systems called the protector. And people who have a lot of longstanding trauma can have these internal mechanisms, and to try and bypass those mechanisms just with medicine oftentimes is ineffective. So I think what you're speaking to, and again, this is my interpretation, is there are modalities to create a softness so people can let go and let in this medicine that can be deeply impactful.
Thank you so much for all of your talk. And as you were talking about the reintegration process and a lot of the somatic pieces, can you describe a little bit more about how the reintegration process looks like from your end, or like whether it's different for each person, or if there's like a standardized way in which like that reintegration, whether it's talk therapy or like I've heard of some people do massage. And as Dr. Mao was saying, like acupuncture is something very novice, is that a word?
Novel.
Yeah, there we go.
Yeah.
Novel. That is something that can be kind of used. Just your thoughts on that. Thank
Yeah,
you.
so I have a massive interest in incorporating body work into psychedelic journey work, and I have one in Santa Monica that I need to connect with, and I have another practitioner in Montana who actually wants to come down at some point. But that is a huge interest. So I don't actually offer body work. That would just be inappropriate. I'm like, yeah, sure, I'll do some massage while I'm in there. You know, like, so I always stay within my lane, and I occupy a very practical space. Like I'm between medicine and mysticism and art and science. Like I'm this very practical, approachable. I'm not I don't dress in all white. I'm not pretending to be a shaman. So there are techniques that I can help people with in the moment. So people that are feeling rigid, I can help give resistance, and sometimes the resistance can create expansive movement. So there are ways in which you can provide even reassuring touch. Like in the medical client or medical patient, the only time you touch is when you're examining. And the same thing with therapy, it's very distant. And so what I'm trying to do is create connection within a container that is safe and nurturing. And so what does reintegration look like? It sort of just depends per client, like what comes up, what needs to be reintegrated. A lot of times the reintegration happens during the integration component of the journey work. So we're just gathering information, and sometimes there's threads that come up that we can pull and follow, and we're gaining content and getting content, and I'm recording and recording and recording. So when we do the integration, I can say, hey, you know, these are the themes that came up. This is what came up. What does this mean to you? You know, what was the symbolism? Was there anything that was confusing? Yeah, I saw graveyards, and then I thought about my dad for, how I didn't know died for 60 years. So there's all sorts of things that come up. And sometimes you can do a little bit of processing in the moment, but a lot of times the meaning making has to be left to the integration piece. So you're just gathering content.
Hi, I wanted to ask about the microdosing. I wanted to hear your take on that.
Yeah. So I provide a lot of microdosing support. Protocols, education. I look at the research. So there's a lot of purported benefits of microdosing. I like microdosing for a number of reasons. There are a lot of people who are on stimulants. Stimulants help with focus, motivation, a lot of the benefits. And this is based on a 2021 and a 2022 follow-up study out of the University of British Columbia with Paul Stamets. Looked at, I think, 8,000 people and another like 500 or 600 subgroup follow-up, showed that microdosing, self-reported, can improve motivation, concentration, focus, and mood with reductions in depression, anxiety, and stress, measures of depression, anxiety, and stress. You think about Adderall or Ritalin, and you sub them out for a microdosing protocol, 2 months on, 1 month off, because there's the theoretical risk of heart valve thickening. People respond brilliantly well to it, and they don't have to be on a pharmacologic. So people respond really well to it. I've had all sorts of people report being clearer in the office, being clearer in their life, being more attuned to the people around them. Again, these are like reported benefits. I've had people saying that they've been able to taper off of their SSRIs, although that one makes me a little confused because of the competitive inhibition of SSRIs with psilocybin. I'm not totally sure on that one, but if it works for them, awesome. So there's a lot of benefits. And so I am of the belief that I want to support people's dependence on themselves. And if that gives them a method that I know that, they don't have heart disease, they don't have valvular disease, and a lot of these, and speaking with sort of the father of microdosing, James Fadiman, he was at the Psychedelic Science Summit. gave a brilliant talk on microdosing. It's just not found, right? Doesn't mean it doesn't exist, but it's not found. And there's a large database of people followed. The same thing with everyone who's saying like, oh, we need to stop. Like these things could be dangerous. Yes. And we also have millions of recreational users who've been using psychedelics for a lot of years. And we're not seeing people drop dead. We're seeing people die of opiates, narcotics, stimulants, antidepressants at rates far greater than anything that we're giving in the psychedelic world.
Thank you. There's also a question online asking around that same idea, cardiac cautions, any other physical contraindications or cautions people should be looking out for?
Yeah, I think it depends on which one, but the general idea is if, and our last doc mentioned it, if you can walk up a flight of stairs and you can do general activity, like you're probably fine. There's some that cause increased cardiac load. So MDMA, ketamine, you have an increased risk of if somebody has unstable angina or other cardiac conditions, you would want to get some sort of cardiac clearance. I think when people are going and dipping into a non-ordinary state, that can be maybe a little anxiety provoking. So there might be slight increases in cardiac load, heart rate, blood pressure. But for the most part, these things are super safe.
Great. Maybe last question from online. What kind of ethical standards are being developed or should be being developed when we think about patient safety, especially when we're often dealing with trauma, sexual trauma? What should we be looking for? What can we look for? How do you implement that?
Yeah, so the really, to be honest, shitty answer is like, I know who I am and I show up in a space where I hold ethical standards, like that's like not very reassuring. The reality is that there aren't ethical standards because there's not a lot of conversation around these. And even in the institutions like MAPS had a very public abuse of power in Canada, in Vancouver Island, where a woman was held by these two people, then stayed in their home, and there was sexual assault. It was an ugly event. And this is in the confines or under the umbrella of these major institutions that are looking to legalize these. There are abuses in Indigenous communities, there are abuses in the underground, there are abuses in clinical settings. And it is something that needs to be talked about sooner rather than later. It is something that needs open conversation. It is something that needs agency directed input to create some sort of standards. But then like, how do you hold everybody accountable? Because you have therapists, you have TCM, you have MDs and PhDs and BSNs. You have all of these people that are wanting to come in that are all under different agencies. There's no credentialing. Like it's the wild, wild west. And the people are the ones, the clients are the ones that are going to be impacted. So yes, there needs to be ethical standards. I have no idea how to answer that aside from like creating an organization. There are boards that are trying to be created. There's the American Psychiatric Medicine, APMA, I think, a Psychiatric Medicine Association that's trying to create standards. And there's another one in Colorado that's trying to create standards, a board trying to get credentialing and standards.
Thank you, everyone. Thank you, Dr. Moos.